All right. Hi, everyone. Good morning. My name's Amanda Ruback, and I'm a nurse and the Community Outreach Coordinator here at the Missouri Poison Center. And today, this morning, we're going to talk a little bit about pediatric poisoning, sort of the 101, try to figure out why, who, and how we can prevent our kiddos from becoming poisoned as parents, as caregivers, and as people who love those little ones. So today, this morning, I have Miss Rosanna, and she is with us. She is a nurse and a certified specialist in poison information who's worked here for many years. And tell us a little bit about yourself, Rosanna, and your background.
You bet I will. Thank you. So I started at Cardinal Glennon 45 years ago as a pediatric nurse, worked the emergency room for years, stayed at the Cardinal Glennon Hospital itself for about 30 years, and then moved over to the Poison Center that's out of Cardinal Glennon. So I have lots of pediatric experience. I think even more so that is neat for me is that I have 4 children. I can totally understand how something can happen. I have twins. There were times where one twin would run to the right, the other twin would run down the stairs, and I'm standing in the middle thinking, oh my goodness, who do I grab first? So I would like to let this be an opportunity for you to ask me questions, and let's have an open discussion. Let's delve into this and realize that we are doing the best job we can of keeping our kids safe. So why are children at the greatest risk of being poisoned? Well, we need to be proud. One of the things about kids is that they're very intelligent. You can sit here as I'm speaking going, boy, you're not kidding about that. They're curious. They love to imitate not just our actions, but they love to imitate what we're saying and what we're doing. And so having a medication bottle or a spray bottle out, they see us using that, they want to imitate that behavior. The other thing is that we need to take into account is that at a very early age, at 4 and 5 months, children are doing what's called hand-to-mouth behavior. Kids at 4 months can take that foot and put it in their mouth, and you think, oh my gosh, if I were only that limber. Well, that also helps them grab a plant leaf and stick it in their mouth. So we're going to talk a lot about those kinds of things. Do remember that our society has changed. We have made things very palatable to us so that medications taste good and look good, but they also look a lot alike. An M&M and a Tylenol gel cap, for example, look very much alike, and a child can't tell the difference. So it's really up to us to try to protect them as best as we can. We know that these are accidents. No one does this on purpose. So please feel free to call us. Put the number that you see on the screen, 1-800-222-1222 in your phone right now if you want to. I welcome it, and I'll stop for a minute for you to do that if you need me to. So what are some of the most common exposures? I think cleaning products have to be number one. We're talking sprays, toilet bowl cleaners, dishwasher tablets, Tide pods, or any kind of pod that's a laundry pod. I shouldn't just say Tide because they were the first to come out with that wonderful product. But kids love these things. They're very attractive. They're squishy. They're colorful. And what do they want to do? They want to put it right to their mouth. I can't blame them. I think that it's an amazing feel myself. The next most common poisoning that we deal with is cosmetics and personal care products. Things that you think about as mascara, makeup, lipstick, deodorants, antiperspirants, which can be very scary if your child gets a hold of them, not because they're poisoning, but because it dries the inside of their mouth. An antiperspirant is meant to dry your armpits. Well, it dries the mucous membrane inside the mouth as well, so they tend to choke on it. Pain relievers are huge. We tend to take a Tylenol or take an ibuprofen and leave the bottle sitting on the counter. Even though we've clicked it closed, it is not child-proof. It's only child-resistant. And I'm sure most of you out there listening to me right now can go, my kid can get this open. I know that mine could. Foreign bodies. We have batteries. We have magnets. We have coins. Things that you would think wouldn't necessarily be a big issue can be huge. And I encourage you to call us and we'll guide and direct you on what we need to do. I discourage using the internet. I think it gives you a piece of information. It doesn't give you the full story. We are trained to deal with things like dietary supplements and vitamins and foreign bodies and pain relievers. So when you call us, we're going to ask you questions and you're going to be like, boy, they're asking me 1,000,001 questions. And it's just to see that you have a safe situation. We don't want to refer you to the emergency room. We want to keep you home. So if you can just remember that, we love it when you call. We are non-judgmental. I have twins that I'm telling you, I gave one of the twins the same medicine twice. I've been there. I have lived this. I want you to know that we aren't here to report you. We will ask for your phone number and we'll ask for your child's name. And that is because we here at the Poison Center have made it our business to follow up with you if it's something that needs to be followed up on in an hour or 3 hours. So we want a good, accurate number. It's not to track you down or, report you to someone. It is to make a good connection with you so you can safely stay at home and take care of your child. It is a situation that at first you're kind of panicked. You're like, what can I do? Just bring that bottle or that spray bottle or whatever happened to the phone. I will help you, and so will the pharmacists and registered nurses. They're on the hotline with me. We will talk you through it. All you've got to do is get to the phone. I think that when you're thinking about these kinds of exposures, there's several things that you can do almost immediately, and we'll talk about those shortly.
All right, let me go ahead and there we go.
So what do you do if your child is poisoned? Don't automatically rush to the emergency room. And in fact, stay calm as you can, breathe, bring the product to the phone. Do not worry about having to read the ingredients. We will help you get that off the bottle. One of the things to think about, if they get a hold of a spray bottle, I want you to rinse. I want you to rinse their little mouth and I want you to rinse their hands. And it goes back to that very first thing we talked about where they put everything to their mouth. So if they've got a spray bottle and they've sprayed it and you think they put it in their mouth, they also have it on their fingers. The last thing I want is while you're waiting and talking to me is for them to rub their eyes with the same spray. So washing their fingers and rinsing their lips gently. You do not have to gag them. You never make them vomit. Just gently rinse the lips and the inside of the mouth. You know how you play with them where you cup the water and you bring it to their mouth and you go, blah, blah, blah. That's what I want you to do. They can sense your urgency. So I want you to breathe and stay calm. Take them to the sink. Make it nice, comfortable temperature water. It doesn't have to be cold. I want you to rinse their little hands, rinse their mouth, then grab the bottle, make sure they're in a safe spot, and give us a call. I will then ask you some questions about, did you see the nozzle off? Did they get the lid off? Were the pills spilled? How many did you see spilled? I think probably one of the hardest questions is when I ask, will you count them? And it's a 500 count bottle. But believe it or not, that can mean a whole lot of difference in how we manage your child. We love being able to keep your child at home with you. We don't want to have to send them to the emergency room. And sometimes that is a really good way to determine we do not have that situation. However, if we do have a situation that we've determined you need the emergency room, we will help you get there. You will be talking with us. We will set it up with the emergency room and tell them that you're coming. We'll have you bring the bottle. We'll explain to you a little bit about what's going to happen, or we'll have you call 911. It's a very smooth process. Please call us.
Great. So much good information. We actually have a question, Rosanna.
Yes.
What are some common poisonings in the winter time?
Okay, antifreeze, things being put in the wrong bottle. For example, windshield washer fluid looks a lot like Gatorade. And many people, believe it or not, transfer those liquids into another bottle. Those particular things can, as you can imagine, I'm sure you've heard, can be very dangerous for children. The other thing you need to think about are the medicines that we're taking during this time of year. Cold products, allergy medicines, those things, try not to take them in front of the kids if you can help it. But if you have to, just click the lid closed. It only makes it just a little bit child resistant, but click it closed and put it high up in a cabinet or a child-proof container. The other thing that I think you think about in the wintertime are the plugins, the little oil plugins. They're at their level. They love to pull them off. They love to stick the wick in their mouth. Just rinse their mouth gently. Don't gag them or make them vomit. Wash their fingers for us and come to the phone with the product. We may even ask you what it smells like if you don't remember what it was, whether it was Bath and Body or Glade. Just bring it to the phone and we will talk you through it.
Great. Well, thanks for answering that. What about labels? How do we read labels properly?
Okay, so labels are hard to read, and I don't know if you have a chance to grab something to look at yourself right now, but it's a little intimidating, but we're here to help you. They can be on the front or the back of a bottle. It can be labeled drug facts. It's a situation that we say, what is the active ingredient? And so you look at the label and you're like, oh my goodness, really, I'm supposed to say this? No, I need you to spell it. You don't have to say it. If you can say it and tell me the milligram amount, that is a huge start. Then we delve into, did you see something in their mouth? Did you see color coming out of their mouth? Were they gagging or choking? Are there pills on the floor? How many do you have left? How many do you think you used? And a lot of parents go, well, I have no idea. But you know what? I don't have any idea how many Tylenol I have left in my bottle, but I do have a good idea whether I've used it a lot or I've used it only a couple of times. Those types of answers for us are invaluable in helping to keep your child safe.
Great.
Let's
look at this other here too.
Yeah. Yes, this is the Sani wipes that we're all using during this time of year with COVID, and just because it's a time of year where people get colds and viruses. Their particular ingredients won't always be on the back. Sometimes it's on the front. And you will have to look at the bottom and it will tell you a percent. And if we say, is it, 0 point something, that little decimal point tends to hide. But then we can describe to you what kind of symptoms you might see, if any. But in this particular situation, again, if your child would get a hold of it, the first thing I'd want you to do is rinse their little tongue off, rinse their lips, and wash their hands, and then call us. This particular one is a great example, I think, because I would want you to basically read to me the front of the label. I would say, read it to me like I'm going to go buy it for you. So I'd have you read Sanidate, sanitizing wipes, kills 99.9% of bacteria. And then I would say to you, well, is it a blue label with a kind of a pine tree behind it, a little green mat? Just so that I can be looking up the same thing you're looking up and get some data from that as well. So don't be surprised if we question you. Those kinds of things help us identify your exact product.
Great. That's great information. It is very hard to find what you need in a panic on those labels. So just know that Rosanna and the other specialists will kind of walk you through it because that's what we're trained to do. So
the big things I think to remember is we're here, we're fast. You won't wait long to talk to us. We are not going to report you. We want to know what happened, and we will ask details. Did they get it on their shirt? Did they act like it tasted bad? Did they seem to have it for very long? Everyone is allowed a bathroom break. Okay, things happen. Call us and talk to us about it. Don't make them vomit. Nothing neutralizes anything. If there is some kind of special treatment that needs to be done for an exposure, we will give you that information, and we will not waste time doing so. I welcome any questions you have, and I really appreciate you taking time to spend it with me this morning.
Great. There is a great question here about, is there a charge to use the Poison Center?
Nope, absolutely free.
Absolutely.
You don't know which button to push one. We don't care. Okay, there's a pill identification button. You don't want that one, but there's different ones. If you're a hospital calling, if you've been exposed, just push one of those buttons. We don't care if you get the wrong button. We just want to be able to talk to you.
Great. Great. And someone else is sharing a story about their 2 grandchildren and taking, the adult takes medicine in the morning and the evening, and they follow them wherever they go. So just an important, again, note about not taking medicine in front of kids, and that imitation factor really is part of that.
And when they go to grandma and grandpa's, tell grandma and grandpa the same thing. Put the pill planners way up. It's the one time that you put your pill planner in one spot so you remember it all the time. But in that particular situation, that's a very curious thing for kids to get into. And it can really save us from an exposure, but at the same time, have them put it up right away, and that way we don't have to think about it.
Great, great. Let's talk a little bit here. I'm going to talk a few minutes about prevention, and we've already mentioned some of these. The child-resistant containers. We've already talked about how things aren't child-proof necessarily. They do slow children down, but they can still open these containers. This little picture here is some different locking boxes and little devices you can use, pretty inexpensive, less than $10 or $15. So especially if you have high risk medicines like heart medicines or pain medicines or other medicines, they really need to be in a locked container or in a locked cabinet, especially when we have visitors or grandchildren or children in the home. We've talked about that imitation. And really, medicine is medicine, and we need to teach children from a young age to know the difference between medicine and candy. So not confusing them by getting them to take the medicine they may not want to take by, talking about it's candy or it tastes like candy. It really needs to be treated as medicine. And then we've looked at some of the labels and how difficult they can be to read, but there's a lot of good information on there, especially in that active ingredient section. Knowing what is in the product helps us so much to be able to give you the best treatment advice and the best assistance that we can give you. I'm going to put up the last slide, which is make sure to save the Poison Center phone number. It's been on the screen lots of times. It's the same number wherever you're calling from. It's 1-800-222-1222, and you'll get a great nurse or a pharmacist like Rosanna to talk you through your situation. Do you have any last thoughts for us, Rosanna, or any last comments?
I just want you to feel free to call us day or night. We do not close. You will get a live person. We're here to help. We can help you get through the situation and let you move on to the next day.
Great. Thank you, everyone. Thanks for joining us. Please feel free to share this with your friends, your loved ones, and those you work with. Have a great day.
Take care.